evening, good morning, and good afternoon for all of you joining from different time zones. We are excited to have the second edition of Code Christians and to welcome our speaker for the evening. I request Dr. ABM Thomas, Principal, Christian Dental College.
Hello, everyone. We are happy to have our Code 2, continuing dental education with Christians. Today, we are privileged to have with us Jaspreet, Kaur, Gill, and she's from the batch of 2004. She's here with her husband, Rashpal Singh, and son, Joram. And also, she's with her parents, Amarjit Singh and Paramjit Kaur. And we welcome all to this August gathering. After her BDS, she left CDC in the year 2009 and she moved to US, completed her DDS in 2018. After that, she managed as a director in a corporate dental practice. And that's for nearly 3 years, where she had a major role in training and teaching dental practitioners. After that, in 2020, she opened her own practice at Murphy, Dallas, Texas. And her practice is titled Countryside Smile. And so we are very happy to have Jaspreet with us. I know that we have so many questions. What after BDS? And she went through these struggles and she chose a path and she's doing well. But everybody has to choose their path. And one day, I'm sure many of you will come and speak the way she is going to do. And we welcome her to this CDC and for this Code 2. Thank you. Please.
Hi, my name is Jaspreet. I'm very happy to be on this side of the assembly hall. I was just like you sitting on those chairs about 14 years ago. So the halls, the roads, the trees, the classrooms are still the same. You are so lucky to be in this institution. And I'm very, very honored and humbled to be here and be speaking to the future dentists of this country and maybe many more countries. So my topic today is going to be, just like Dr. AB said, what's going to be after education. So I'm not going to give you answers. Probably my presentation is going to leave you with more questions in your head to find the path that works for you. So we're going to get started with the presentation. If you can share the screen. The last time I came to CDC was in March of 2009 to get my BDS degree. So it's been 14 years almost that I spent here, just like you all did. The BDS first year students are really young. They are about teenagers when you start. But after so many years, one thing that joins all of us is dentistry. It's not just an education, it's going to be your future livelihood. So in order to understand how you are going to be earning your livelihood for your future families, for your parents, for your future ambitions, your dreams, you need to understand how dentistry is going to make that happen for you. These courses are going to be so important, but what are some of the things that are going to be there with you forever is what we're going to focus on today. The presentation is in two parts. The first part is to help you become a good clinical dentist. There are some 10 or 15 foundational principles of dentistry that every dentist must perfect on to be able to practice dentistry the way the patient would love. The second part is focused on when you have become that dentist, how you're going to be able to earn the money or be able to sell your dentistry in a way that you can achieve all your dreams that you and your parents have thought of. So this is me. In 2009, I got my degree with Dr. A.B. Thomas. And this is 2014. I graduated from Virginia Commonwealth University from DDS class of 2014. So this is here me in 2009, and this is 2014 at VCU and graduating from TDS. This is a long journey, and everybody has to think where they want to be and what you want in future from being a dentist. We focus on a lot of academics. Your teachers here focus on a lot of hardcore principles that they want you to do it their way. Some of those principles I still use, especially in perio and oral surgery. So whatever is taught, I still use what was taught in CDC. It was taught better even than what I learned in VCU. The way you have access to this grassroots, conventional, traditional dental methods and teaching methods is going to make you understand the future of higher technology uses of dentistry if you understand the core concepts when you're doing, say, hand scaling, or where to put my finger rest, or where to numb. So those things are still going to be the same. Those things cannot be automated. So I'm very glad that we had those kinds of exposures at CDC. I'm also thankful to be exposed to the foreign author books, the Strudevants, the Carranzas, the Schaeffers, the Petersons. Those are the books that are read at international level. Whatever you're reading here, the same textbook a student sitting in the US is reading. So if your teacher wants you to read that book, that is for a reason. And I'm very thankful for all the teachers that have put in so much effort in making us understand the basic concepts of dentistry. So I would suggest and really suggest the BDS students to follow the guidelines that your teachers have been saying to you and take the full advantage of your time at CDC. Once you go out from here, there's a whole different world, and it's not easy. It's going to be difficult. So you have to plan in advance. You have to think where you want to be in next 10 years, 20 years, 30 years. The only thing common in all these years is going to be dentistry. So what you want to do every day at CDC is to focus on to learn some valuable concept of you making a better dentist. Maybe it's as simple as learning how to do inferior alveolar nerve block. If you learn that one little thing in one day, that's going to be stuck for you for the next 60 years of your profession. And believe me, that's not a small thing. Wherever you go, the patients, the mouth's anatomy is going to be the same. So during this time of your education, use the best time to understand the concepts that are written in theory, how they can be converted into practice in a patient's mouth. Don't limit yourself to your book. Take that knowledge from the book and apply whenever you see any patient. Even if it's a small thing like how to do scaling on distal of a second molar in the furcation. That little concept is going to be a very good learning experience. So after I finished my DDS, you still have to keep continuing education, did fellowship for implants, and laser dentistry, and surgical and prosthetic implantology. So the first essential property for a good dentist is to be able to understand your patient. This sounds very simple, but it's very complex. If you are a good communicator, say you want to go practice in the US, you have to practice the way patient in the US will come talk to you. So right now, practice what your patient is telling you, understand what's hurting to them, understand what's making them better. Sometimes you might see a tooth that looks worse to you, but the patient is being bothered by something else. So give a very careful ear to your patient, understand what they're telling you, and understand how you can help them. So communication is the biggest key to a successful physician or a successful clinician. Your patients are not going to see the beautifully carved amalgam you're going to do on an MOD. Your patient is going to feel the human touch, the human talk, the human smile, or the human care you give to your patients. So whenever you have a patient interaction, practice your communication skills. If you're going to go to a different country, practice on learning the languages spoken on those countries. The second would be pain. In dental chair, what's the biggest fear of any human being? I don't want to feel the pain. So as future dentists, you have to perfect your anesthesia skills. You have to know the first year anatomy of head and neck. You have to know the types of anesthesia. You have to know when to use how much of anesthesia. You have to understand what blood pressure is going to be doing to anesthesia. And if a patient has hypertension, how are you going to make that tooth extracted when you can only use, say, 3 ml? Different types of anesthesias, chemical-based, and your techniques makes a big difference. Sometimes I tell my assistants in the US that I want 3 carpules. In the US, we get pre-made anesthesia. So I use articaine, lidocaine, and cetanest. One of them doesn't have epinephrine. The other one have a little bit. The other one has 1 to 100,000 of epinephrine. So if my patient has blood pressure, I exactly know how much of epinephrine I'm giving. So all those numericals we do to calculate the toxicity, those matter. So try to perfect your anesthesia skills. The best part to do is when you go to a dental camp, practice your anesthesia skills. If you can have your patient go pain-free, they're going to love you for rest of the life. The second would be your patient is not just a tooth. Your patient is a human being. They're as big of a human being as your parents, your families, your loved ones are. So most of the present day humans suffer from diabetes, hypertension, high cholesterol, pregnancies. So all of these systemic conditions are going to be in your chair when you become a dentist. So you have to understand how to deal with the patient with those systemic conditions. Those do affect, diabetes affects periodontal disease, hypertension, it's anesthesia is related, pregnant patient in pain. You have to understand and link anatomy, general medicine, oral surgery, perio with your clinical systemic status of the patient, because you're treating a patient, not just a tooth. The other essential feature is if you cannot diagnose, you cannot help a patient. You have to see what's wrong. Your x-rays, they have to be impeccable. You have to see the entire root, the entire tooth, the bite wing to see the MODs. If you have a 3D scanner, you can show that to the patient, but you have to understand what those different grays are and the blacks are. If you will not diagnose the MO, or if you can't see the periapical radiolucency, you won't be able to help that patient. So however hard it is to take an x-ray on the patient, if they're not biting correctly, don't just see a tooth. You have to see a tooth in a perfect image. So perfect your oral diagnosis skills so that you can tell the patient what's wrong. We're not just guessing. We're giving them a diagnosis. You're telling them, yes, you have pulpitis because I see the decay is touching your pulp on the mesial pulp horn. You have to be able to make that sentence to be able to tell that patient, yes, I know the science behind it. The Student's definition of dentistry says the art and science, right? Dentistry is an art and science. With the evolution of technology, the science is taking over the art. So you have all the tools in the hand to be able to tell that patient, yes, what's wrong? And this is the science I can help you with to make you feel better. So once your patient is in the chair, don't just do a Band-Aid treatment. They are here not just for one tooth. You are studying all these different cons, perio, oral surgery, oral diagnosis, pedo, ortho. You have to have a diagnosis for everything. The big difference I found once I studied in the US versus I was studying here was we were not connecting the dots. We were not connecting the same patient seen in a perio chair versus the same patient in an endo chair versus the same patient in a cons chair. So once you are seeing a patient, think from a bigger perspective, just like the younger generation, zoom out. Don't just see a perio in that patient. If you're scaling a tooth and you see a cavity, think, if I can make this tooth better, is it going to be a filling? Or is it going to be a root canal with a crown? Or is it going to be extraction with an implant or a bridge? So connect the dots. That patient, when he or she comes to your private practice, they don't want clean teeth with cavities. They want a nicer smile. Why are they coming to a dentist? They want to have a better looking mouth. So connect all the subjects that you are studying and join them together to make a person smile beautifully, smile painlessly, and have their teeth for a lifelong time. So just like you have a travel plan in the US, we make something called a treatment plan. So treatment plan is a step-by-step procedure that we make in the order of priorities. It is in different visits. So I will highly suggest, I'm not going to teach, it's a whole different course for like an entire year teaching treatment planning. So I want you to go home and find out how do we do treatment planning. By the way, Carranza has all the phases of treatment planning in it. So that would be a hint to start reading Carranza and find out how you can treatment plan, not just perio. You have to utilize the same methods for your endo and fit in the cons and fit in the ortho in it. Once you have a treatment plan, say, hey, patient, you're going to have 7 visits. The first visit, we're going to extract the tooth that's hurting. The next visit, we're going to clean your teeth. The third visit, we're going to fix all your cavities. The fourth visit, we're going to replace what's missing. To do all that, you have to be able to see each and every time what you're doing. So the basic principle for a dentist is to know their tools. The first tool is a dental chair. Go to an empty chair, learn all its features. Stand next to it and see where is your elbow and where is the patient's head. And that's not going to be the same for each quadrant. Every quadrant has a different patient positioning and a different doctor or the student positioning. So you have to find out according to your height and your chair, are you going to be able to sit and work or you'll have to be standing and working? Especially the dental chairs, they're not meant for the stature that we as Indians have. The specifications of those chairs are meant from the Western athletic build of the doctors. So you'll have to go home and think, am I doing something wrong? Are my shoulders hurting? Why am I twisting my neck here and there? Use your mirror in your hand. You should be sitting in a perfect posture, lighted the tooth, use your mirror, use your magnifiers. Try to invest in yourself by buying some magnifiers yourself. Your teachers would be impressed. If you will find a magnifier and tell them, hey, I'm seeing this better with these magnifiers. In the US, the first day, that was the most biggest memory that I have was we were not allowed to see any patient, not even for a checkup, without the use of a magnifiers. If you have used a microscope in microbiology and you have seen those bacteria, you will see a whole different world of teeth when you use magnifiers. So ergonomics is really, really important. Lighting is really, really important. Positioning of the patient and yourself is very, very important. Otherwise, you cannot practice dentistry for 50 years if you want. You will have shoulder, neck, back issues. So try to develop good habits of postures right where you're learning from now in your previous days. Once your patient is seated in the chair, you can see the perfect tooth. Now you have to use a perfect instrument. You cannot use a wrong Gracie curate at the wrong tooth. It's not going to do any good. It's going to injure the tissue. You cannot use a wrong burr to open a class 1. You cannot use a wrong burr to make a PFM crown prep. You're going to have a wrong chamfer or shoulder. So you have to know exactly what burr or what elevator or what forceps is meant for what tooth when your patient and yourself are seated in a perfect posture. So the first thing was anesthesia. Second thing was your x-rays and your diagnosis. Third was your positioning. Fourth is your tools. And those are the fundamental concepts of dentistry. Every dentist is going to have to do some kind of surgery someday. You have to know how to cut your tissue. It has to be a nice, clean cut with the blade. You have to learn how to make a simple incision before you graduate. What if you're in the middle of nowhere when you go for rotations and you have to do a surgical extraction or drain an abscess? And if you don't know how to use a blade at what surface, then you're not doing good to that patient. And if you have made a cut, you'll have to know how to close it. You have to practice your suturing skills. Your sutures cannot be too tight and cause ischemic damage to the tissue, or cannot be too loose and let all the bacteria go into their surgical site. So the basic handling of a blade and a suture needle is a fundamental concept of becoming a good clinician. Now, if you have to do restorative dentistry, fillings, ceramic crowns, or any restorative, you have to understand your patient's tooth cannot be too dry or too wet. You have to learn where to put the suction, where to put your cotton roll, where to tell your assistant to put a suction. Moisture control is very important. In BDS days, if you're putting an amalgam in a pool of saliva, you're not doing good to the patient. You're putting bacteria underneath that amalgam. So you have to get your perfect isolation. Practice makes it perfect. The more patients you do, you will exactly know what part of the tongue is going to push out that cotton roll. And you will exactly know where the frenum is. Don't put the cotton roll on the frenum where it's going to fall out. So those are the fundamental concepts of dentistry. There's going to be no technological advances to these things. These are still going to be manual. So the more we practice, the better dentists we become. When you go into perio and cons, you've heard of a term called biological width. Biological width is not just a theoretical term. The more dentistry you do, your perfect looking crown is not going to be looking good if the tissue around it looks beaten up. So tissue is always the issue. It's as important as your tooth is. I would suggest, if these days everybody has smartphones, try to take pre and post-op pictures of your work. Your cameras would tell you, even if it looks good to your eyes, your cameras would tell you it's not good because the tissue is not looking as pink as it should. And follow those pictures. If your patient's coming back for another quadrant of perio, try to take the tissue color changes of the first quadrant you have done. You will feel better about what big difference you have done to that patient. So dentistry is not just dental, it's also tissue related. And it's the more you study, if you go into postgrads, this is a very valuable concept, even if you go into implants. Implant prosthodontics is all based on the tissue reaction to how you are placing in the implants, where the implants go, your planning of the implants change if the tissue biotype is thin or thick, the type of abutment you're going to use. So those all things are connected. Your cons is connected to your perio. Your perio is connected to your oral surgery. All these things are also connected to ortho. So if you do a crown and your patient has a deep bite on it, the occlusal trauma is not going to make your tooth look nice. That tissue is going to get really sore. So connect all the specialties and think from a bigger perspective, zoom out and think. Always remember, if something doesn't look nice to your eyes, it's not going to look nice to the patient. If you don't like the shade, if you don't like the shape of your filling, your carving, or if you don't like where the articulating paper is biting down on the occlusal, it's not going to be a successful, long-term lasting work of your dental procedure. So any dental procedure has to look nice, has to have a nice shape. Study the cosmetic dentistry concepts, the golden rule, your TMJ, your occlusion, all the contact points that come. Those all things are practical things. They're not just for your theory exams. So those points that come on the occlusal marks when you take an articulating check, if they're not balanced, your work is not going to be long lasting. You've done all the work, you've sent the patient home. Have you told them what to do? Have you told them what their homework is? You numb the patient. Well, the numbing is going to not last after 4 or 5 hours. They might have pain. Have you prepared that patient of what to do when they are at home? Have you told them about the ice pack or taking their ibuprofen or acetaminophen or flossing or brushing in a certain way or using a mouthwash? Most importantly, have you told them to come see you back? One thing I have learned that is different versus learning here versus in the US is you never let any patient go without a next appointment. Just like our cars and vehicles need yearly maintenance, your dental work does too. So every patient has to have a yearly follow-up or a 6-monthly follow-up. And if they don't understand why, it's your responsibility as dental professionals to tell them why. This is where our part of the world is lacking, that we don't tell our patients why their healthcare is important. It's not just for extraction of an abscess. So do a full mouth diagnosis, a full mouth treatment planning, a full mouth treatment, and then have them coming back to you to take care of the expensive work that they have done with you. It's just like buying a car and doing the oil changes every 6 months. So 5 years or 10 years from now, if you have done all the education, you know what the recipe is for your dentistry. So like for me, in my recipe, pediatric dentistry is not part of it. Ortho, I do only clear aligners. So every dentist is going to have a recipe of procedures they love and the recipe of procedures that they will not love and would like somebody else to do it. So once you find those recipes and use these principles, you're going to have to learn how to sell that recipe to be able to make your living. Because otherwise that recipe is doing no good to you. It's not just about marks and distinctions and medals and names on the boards. It's going to be your livelihood. So you have to learn how to earn that livelihood and how to be proud of your work as a dentist in the future. So after all these years of learning, I was blessed to have my own private practice 2 years ago in the US. And it opened a whole different set of challenges for me. So it's not all a fairy tale. You have to keep learning every step of your way. So once you have to open your practice, you have to learn the business skills. You cannot open a business in the middle of a desert where nobody is going. So in Ludhiana, what's the popular spot? If your practice is in the popular spot, that's where you're going to find patients. So you don't have to be MDS or PhD or DDS to open a practice. After doing BDS, you get your state registration and you are fully legally responsible to open a practice. So during these 5 years, plus that internship, you have ample opportunity to get those 15 principles perfected upon. If somebody had told me that so many years ago and felt me and have me feel that I could be empowered to open my practice at the age of 25, I would have opened my practice at the age of 25 without going through all this struggle and studying more for so many hours. And we would have started earning money for so long ago. So if you are a clinician that knows the basic dentistry rules, you can do a nice filling, you can do an acceptable denture, you can take a patient out of pain, you can find a perfect location. India doesn't have so many dentists practicing here in remote areas. Everybody's trying to go out, but you have an ample opportunity to practice here itself. Once you have found where you want to practice, you have to learn some business skills. The word business is as confusing as a root canal to a human being. If you tell a patient, oh, you need a root canal, they immediately get scared and they think, oh my gosh, it's going to hurt. Same way, if you say, oh, I'm going to open my business. Well, dental practice is a business. It's a small private business owned by a doctor who has never been taught any business skills and who has to do dentistry and collect money from someone to do that dentistry. So you have to understand the steps of opening up a business. And that's what I learned after I graduated from DDS. And that was not in a school. You just learn it from, I guess, use Google these days, and maybe some business management classes. The first step is making a business plan. A business plan is kind of a dream that you would imagine your practice to be. You have to think what kind of patient you want. Do you want old patients? Do you want young patients? You want high-end patients? You want routine patients, not high-end? So it's up to you where you want to open the practice, what kind of the area that is, what kind of the patients you want, and what kind of procedures you want. You cannot be doing just extraction and dentures in a higher end practice, right? So your recipe is going to be linked to your location and to your business plan. Once you have a business plan and you have to open a practice, you need all the tools that you see around your dental school. You need chairs, you need suction, compressor, all the mechanical stuff. Do you even know how your dental chair works, how the suction works? If you have a practice, if that goes wrong, how to fix it? Who to contact? Is that person ripping you off? So you have to learn all the backside of dentistry. You have to negotiate with vendors. You have to find a vendor that's trustworthy, and you have to do research and have competitors giving you bids for different things. Okay, you have everything in your office. Now you need people to work for you because you cannot do dentistry on your own. You have to learn how to be an employer. You have to learn how to treat people as employees. You have to train them. You cannot be just judging them. You cannot grade them if you haven't trained them. So you will have to find a team member that's going to help you answer the phones, welcome your patients, assist you in the chair, and many other tasks which you discover when you open up a practice. Okay, you have a team, and now you are all ready to get patients into your building. Do you have a workflow set up? Just like when you go to the airport, there's a step-by-step things that you have to do. Do you know when the patient comes in, what your receptionist says, what payment methods they have to use? What are your prices? Your prices are going to be depending on all the clinician skills we learned. If you don't know how to flap and suture the perfect way, you cannot charge a lot for your extraction. But if you know, and you are so proud of your dental work, tell them whatever fee you want to charge for, and you'll be confident enough to tell them, yes, that's my fee because of all the practice and education and the time you have spent perfecting that technique. Patients these days also want installments. So think about those things. Once that part is set up, now you have to find patients. How are you going to find patients? How do you find a restaurant? The same way you find a restaurant to go to, the patients are going to find you. So BDS is not training you how to do marketing online or making a website or social media or Instagram. It's not just for your personal things. So you have to start thinking about using the time you spend on the phone in a useful manner. So once you open up your practice, you'll have to have a digital presence. If you don't like a website and you don't want to go to that practice, even if the practice is way much nicer than the website is. So the first impression your patients get is going to be from your digital presence on the website or your social media or your Google reviews. After all that is set up, you have to understand how you're going to do marketing. There are three terms: marketing, advertising, and branding. Take the best brand in the world, Apple. They still have ads. but everybody wants an iPhone. Why? Because iPhone has perfected itself. You have to be a dentist that knows all the clinician skills that we talked about. You cannot buy a phone that hangs up or doesn't take a nice picture. So you have to have your core skills ready before you say, hey, I am so good, come to my practice for being my patients. So until you are a good dentist, don't start advertising, because people are going to be not happy to find that it's false advertising. Marketing includes advertising, branding, and talking to your patients. If you go into business management classes, there's two types of marketing for dental offices: external and internal. External is, say you want a patient at CDC, they have never been here, they found you through Google or social media. So that's external marketing. Internal marketing is, someone saw a patient here, the patient was so happy that he told 10 other patients. That's internal marketing, and that's free. If you treat your patients so well, they're going to send you more patients. Branding. One day at our practice, we're wearing scrubs. The next day, we're wearing jeans. The next day, we're wearing something else. People don't get that same kind of feeling when you go to an Apple store, right? They have the same colors everywhere. They have the same dress code. So keeping consistency of the appearance of your office and of your skills, that's what branding is. And advertising is paying someone. It's the paid marketing is called advertising. So once you're advertising, patients are coming in, what are you doing? Are you just doing the dentistry, or are you giving them an experience? By experience, I mean, okay, they come to the waiting area. Do they wait for a long time and the receptionist doesn't smile? The receptionist is rude. That's going to be a big no-no. They still haven't met the dentist. They don't know how good of a dentist you are because they have been so mad at your receptionist. What if someone answers the phone and they're like, hello, this is this office. Or while someone is like, hello, this is Countryside Smiles. Welcome. How can we help you? So those all things matter when the patients are going to come to your office. So it's the whole experience. It's not just a filling. The filling is going to be the last topping on the cake. So before your patient is in the chair, everything that happens before that, you have to make sure that that is perfect, step by step. Cleanliness. How do you like when you go to a restaurant when the table is dirty? Even if the food doesn't taste good, if the cleanliness is there, the tables are clean, everything's shine and sparkly, food is average, you will still want to go back. If you don't have the primary grooves on amalgam, patient doesn't care. But if you have a clean office, you have a nice sealed margin on your filling, your receptionist is smiling, your patients will keep coming back. So all these small things matter. And remember, you have to be there for your patients forever. They go home and they say, oh, my tooth filling is still feeling high, or it broke, it cracked, it's sensitive. Will you be like, oh, I took your money and now I'm not going to help you? You still have to help your patient. They have to feel the experience that, yes, this office is going to be there for me. And if you are always there for you, they're going to send you more patients. If you just turn them away after you're done with their work, they're not going to send you more patients. So the credibility comes with the word of the mouth of everybody who's going to be in your office. Another thing is planning. So once you are doing so many fillings, crowns, everything, you have books, you have money coming in. How are you going to track it? You have to do taxes. You have to have a bookkeeper. You have to learn how to do an inventory. You cannot be just ordering composites when you don't have any patients for filling schedule, right? So you have to understand the concepts of supplies, ordering. Are those supplies getting expensive? Have you thought of profit per procedure? If you're spending 200 on one filling and you're charging a patient 100, are you making money or are you losing money? So you have to think of all those things before you open up an office. one major thing that business schools teach is called key performance indicators. So if you use a software to run the operations for your dental office or say dental school or dental college, how much the patient is paying, how much the balance is, you have to get a report card of your office. Those are certain financial numbers that you have to understand. This is just me not teaching those. I'm just exposing to the ideas of those. Thank you. So that you know there's a whole different world outside of doing BDS. Productions, collections, account receivables, who owes you money, how are you going to collect it? Are you collecting the same day? Or are you making money? Are you getting something in your bank? Or are you just telling people, oh, keep it on my account forever? So that's not making profit. That's not the return on investment of all the education you're going to spend here. Second, lastly, you will make mistakes. Everybody makes mistakes. But the thing is, you have to learn from your mistakes. You know, if you see your patients after 6 months and you don't like the filling that you did, and you're like, who did that filling? Why the margins are so black? You will understand that, you didn't polish that filling well, or there's a void. You will be the judge of your own work, and you learn and you rectify your mistakes. And sometimes, say, the patient never gets numb, or it doesn't work out. You open up a tooth and it turns into a root canal. You can see the pulp. You have to be prepared for the worst. What are you going to do? Are you going to tell the patient that now I can see your pulp, or are you going to put a filling on top of it and have them suffer in pain? So unless you perfect the clinician skills, it's not wise enough to start thinking about business skills. And the best way to do that is while you are in school, while you are here. You're spending so much on your education. In the US, they taught us the first day, it was not in rupees. My parents are here. They're not business people. It's in dollars. We used to think how much Indian rupees I'm spending per day at a dental school. It was more than a 5-star hotel in Delhi or Mumbai. Are you getting that kind of education? Same way here. How much are your parents spending on tuition at CDC? Divide that by 365 or whatever the number of working days are. You might be surprised how much you're spending per day. What are you taking home worth that money? Every day is important. So think those things seriously. Take advantage of the time being here, the awesome faculty that's here. It's one of the best colleges in the nation, or I would say, in this part of the world. I was not feeling as, low confidence, or when I was in the US, I felt confident answering questions that they were asking me. I was sitting next to Dr. Laskin. Dr. Laskin, the oral surgery book that we read, he's from VCU. I was sitting next to him. He asked me a question. I didn't know he was Dr. Laskin, and I rattled the answer like we used to do here at the oral surgery. So be proud of those things. Spend your time worth the money that you're spending here. Life is too small and the time goes by so quickly that you will be surprised that dentistry is for your livelihood. It's not just for, little festivals that we have. Yes, those are important, Instagram photos or things like that, but there's a long road ahead of you. Have you thought where you're going to be a dentist at? What are you going to do once you have your own office? What procedures you're going to do? How much are you going to charge? What car you want in the future? How that dentistry is going to help you buy that car? So those things will make your dreams come true. And dentistry is a very good profession to achieve all your dreams. I'm very proud to be a dentist. Dentistry has given me everything I wanted. I don't know what else I can ask for. It was just the dental education that made me what I am. And it was this institution that introduced me to that dentistry. The first time I had to numb a patient, my mom is still here. And I told her, Mom, today, my 3rd year, I'm going to the oral surgery rotation, and I have to numb my first patient. You know how you are excited going to the oral surgery for your first extraction. I still remember that day. My hands were trembling, pulling up that lidocaine into the syringe, putting into patient's mouth, and getting that tooth out. That was a fairy tale. And when I do my implants now, on the other side of the globe, and the patient comes and tells me, I didn't feel any pain once I went home, because I remember how Dr. Lakshman or Dr. Gandhi or Dr. Inderjot told me where to put that elevator. If the bone expansion is not enough, don't put your forceps, your root is going to break. Those little techniques, they matter. Once you are what you are, don't forget your family. You know, it's not just work and money and friends. It's a work-life balance. You're going to earn for whom? To have happiness. And earning is not happiness. Satisfaction is. You have to find a level what satisfies you. Some people, they don't need much to get satisfied. You don't have to be heroes to be satisfied. So think what satisfies you, how dentistry is going to play that role to satisfy you, and how you're going to enjoy that life by earning what you are going to earn with dentistry.
Thank you, ma'am, for zooming it out and showing us the bigger picture. And these are many things which doesn't fit in the syllabus, but are as important. And it was a wonderful session, ma'am. And before we open it to the students here, we want to thank all the alumni. We can see 22 of them were online. And any questions from the online audience, you can either put it in the chat or please switch on your videos. So we would know that you would like to. Yes, we see a hand. Please unmute.
Hey. Hey, Jaspreet, this is
Hi,
Dr.
Nitika.
Nitika here. That was a lovely session. Are you surprised to see me?
Yes, that's my classmate. She's an orthodontist in Jalandhar. She couldn't be here, and she's just cheering me up, and she agrees with all that we say, and we practice and we learn.
So how are you feeling?
You want to add something that I have missed, Nitika?
No, it was perfect. I just want to ask you, how are you feeling going there after so many years?
It's nostalgic. The bumps in the roads and the bricks and the smell in the hallways is still the same, even though it's renovated and it's on all modern, but it's still the same. I can still see both of us sitting in the corner in the stage. Yes.
Yeah, I'm also feeling nostalgic now. Okay, bye. See you. Good luck there.
Thank you, ma'am.
Thank you.
I would like Dr. AB to conclude the session.
Thank you, Jaspreet, and we are so happy and we are so privileged to hear all the things what you're doing, and we are so happy, and the practice tips you have put from your experience is great, and we want to wish you all the best in your life, and the most important thing is family, which you have really highlighted. Thank you so much. God bless you.
Thank you so much for having me and allowing me to do this. If you have any questions, I put my email. Please feel free to ask me. Any student who dreams of coming to the US, wants to shadow, wants to know anything, you know how to find us on social media or on WhatsApp group. Your school is doing so much. Your alumni is there for you. So don't hesitate to contact us if you need us for any questions.
Thank you once again, all who have joined us online. We'll see you for Code 3. Thank you.